So I was introduced to PRIA Healthcare when I worked for Vertiflex, and we realized that we had a great product, we had great data, we had a level 1 code, but we needed help.
So PRIA is a name that's been fairly common in our practice for several years now because I've always been a proponent of innovations and newer technologies that provide the best care for our patients.
Because let's say you have a wonderful new device and you come back with a poor reimbursement bit of advice, and that limits the possible application of this device.
Right away, the conversation of reimbursement and coverage to help these patients be treated by these new technologies comes right to the forefront of the conversation.
I think PRIA has offered a middle ground, a liaison between practices such as mine and newer innovative companies that just don't have the initial resources to do that kind of things in-house.
This type of work is critical, and I would say informs how startups will get funded.
Going back 5-6 years ago, some of the newer technologies that's come out, they also made it available for us to collaborate with PRIA to help our patients, to advocate for their care, to be able to seek the authorizations and the reimbursement that they need in order to get these treatment options.
The reason PRIA stands up and is so successful, and I think working with many companies I know, is that they take that burden off the physicians, execute successfully with the patients who are really just advocating for themselves.
The more that I used PRIA early on, I realized how important it is to partner with a patient access company. Physicians are busy, so they want to know that the conversations they're having with the patient is not for naught.
And those offices aren't put together and designed to go fight insurance conversations and really try to determine some of these coverage battles. And PRIA alleviates that.
The portal is extremely user-friendly. So I think these physicians, and primarily the office staff, right? The physicians need to get on board, of course, but the office staff is actually the one putting the patient through and doing the work. So I think with that said, the physician wants to know that their office staff isn't going to be overburdened. And I think that portal makes it just super easy. Then I think the second portion of it is the onboarding call, the number where there's direct contact to somebody within the group where they can always obviously have that live feedback. So they make it easy for the end user or for the customer to just really have that access, and then also just the results.
Because of that, the way PRIA executes and understands, we decided to sign up and partner with them again.